Hello there, Wanuri here, and this is Wanuri's Escapade. Thank you so much for always tuning in, following up, and of course watching everything that we get to post there. We are always happy and privileged to have you as part of this family. And today we have a very beautiful topic that touches each and every life today. And for your information, this topic is the reason as to where you and I are existing today. We'll be appreciating some of the people who have participated in your life and my life in one way or the other. But before we get to it, I want to present to you a very beautiful gift that I have for you today. We are at a place called Ridgeway's Garden in Meru. They offer some very beautiful services. They have a car wash, a restaurant, and a place for your event. And for your information, if you are a movie person, as you enjoy your cup of tea and your favorite drink, there is a place where they have set aside where you can enjoy a movie in the night, in the evening, and I'm telling you, this is a place you will love. That is at Ridgeway's Garden, just a few meters from Makutano, Meru. And of course, they have some nice spaces for bonfire and so many other services. So my dear friend, make a point of coming over here and enjoy yourself with your loved ones. There is a space also for children where as you enjoy your time with your loved one, you know, your children can be playing. They have a very nice play area for your children. Now, I have a guest with me today. She is a very young, beautiful lady. I have to emphasize on beauty and young. I know you know the thing we usually say, beauty with brains. And that is what we have today. And I want us to look at a topic that is one of the most interesting topics, and especially men have no or have a little idea of what goes on, although I have seen most men have started getting themselves engaged on this one. And today we are looking at pregnancy and the journey of pregnancy, and we will be asking her so many questions on this topic. But before then, remember you can actually send your questions, and as you follow our page, there is a comment section. Remember to send your questions there in case you get any, and we will be responding to them in due time. For now, allow me to introduce our guest. She's a young, beautiful lady, as I said, and I won't say no more. I'll give her this opportunity to introduce herself. Alafu, we continue. Karibu sana.
Thank you very much. My name is Beth.
So you have decided to take my name.
You know I love you.
I can see even in the name.
Yes. So my name is Beth.
Yeah.
Mudiora. Most know me as Beth Putiel or Beth from Grace Park, because that's the place I work at. I'm a nurse by profession, and it's a calling to me. It's not just a career. I chose it, you know. I chose it. So in my journey as a nurse, I've done a lot, I've seen a lot, and I love that as my career and as my calling. I'm a mother of 2, and I'm married to 1 man. So please, hata kama beauty imetajwa.
You don't want prospects?
Yes, please. I'm married to 1 man as so-called Putiel. Yeah.
Okay, we are so glad to have you
today.
Here. We are very happy to have you here. And as we invited you here, there's something you mentioned that as you are a nurse, you say specializing.
Yes.
In what?
In midwifery.
Now, when you say, is it wife? You know, now I'm a wife.
Yes.
When you say midwifery, it sounds like you're
No.
saying it's supposed to be midwifery, not wife-free.
No.
Is it?
When we say midwifery,
Yeah.
it's when you say wife-free,
Yeah.
it may sound like it's women
Yes.
who do that.
Yeah.
But it's a medical term.
So even men
Meaning
who are
a
doing the same
midwife.
thing are called the same.
Yes.
Okay.
Utasema midmen.
They are not mid husbands.
No.
It's not mid husbandry
Husbandry. No. So it's a medical term
Okay.
to describe a person or a professional who helps mothers to go through the labor and the delivery process and conduct the deliveries.
Yeah.
Though we have someone called doula. There's a doula.
Called what?
Doula.
Dola.
Yeah.
Okay.
A doula
Yeah.
is a person, it's like a companion.
Okay.
Or a person
Yeah.
is a profession who normally helps a mother go through the labor process. They will do the back rub, the exercises, the movements. If they need to do a bath, they are the ones who will do it, all that.
And do you need to go to school for that? It's
No,
just
it's okay.
training.
It's like we have nurses.
Yeah.
A nurse doesn't need a lot of medical things
Yeah.
to assist a nurse
Yeah.
or in a hospital setup.
Yeah.
But they need the basics.
Yeah.
So a doula will get that information that a mother needs a back rub, they need some warm compressions, cold compressions, and movements and all that. Yeah. So there's a difference between a doula and a midwife. A midwife will do the medical part of it.
Part of it.
Yeah. So I don't need to be with the mother throughout
Yeah.
because there is a companion or a doula.
Wow.
Yeah.
Now you have said something I have never known. Kumbe there is even a name for
Yes.
that. By there, as you are talking and you are mentioning about back rubs,
Yeah.
because I think we are already into the topic already.
Yes.
When you're talking of back rubs, is it just for relief, ama they help in the process, ama what's the need for the back rubs?
Okay. What happens
Yeah.
during the labor period?
Yeah.
There is hormonal effects
Yeah.
that take place in a woman's body.
Yeah.
It normally sets in at around 37 weeks towards 38 weeks. So when these hormonal effects occur, there's
Yeah.
something that happens to the pelvic bones.
Yeah.
So they start softening
Yeah.
to accommodate the baby during the birth process.
Yeah.
You see now that softening,
Yeah.
it makes the coccyx. Unaona hiyo part ya mgongo yenye inakaa hivi, the last part of your spine.
End of the tail.
Yes, hapo chini kabisa. That part, it becomes flexible.
Yeah.
Inarudi nyuma kidogo
Okay.
to allow,
Outwards, ama inwards?
Outward.
Okay.
to allow the head of the baby
Okay.
in. So the bones will move out
Yes.
and the coccyx will go back to allow the head to get in. So that pulling off the spine,
Yes.
it's what causes that pain.
Okay.
So anytime there is a contraction,
Yes.
the baby pushes
Yes.
in.
Yes.
So it pulls
Yes.
the bone.
Yes.
So there is that itchiness, that
Yes.
pain.
Yes. Yes. Yes.
That pain. So when you rub it, there are those who will tell you, I don't want back rub. It is okay.
Yeah.
There are those that pain never goes back. It will remain at the lower segment of the abdomen. But the back pain, when you rub the mother, there's that relief.
Okay.
It's like when you have a ache
Yeah.
and you rub.
Yes.
What happens? There's
You
a soothe.
soothe.
Yeah.
What?
Yes.
And that's why we are doing this show, so that we can understand so very many things, because some of these things we just get to see and we don't even understand there is a meaning to it.
Yeah.
And yeah. Anyway, so let's talk about clinics briefly,
Yeah.
and then we get to something else that I really want us to talk about. Tell us about attending clinics, because I have realized there's a certain group of ladies who don't attend clinics because they think, I mean, as long as I'm eating and I'm mobile, if I may say, I'll be just fine, the baby will be fine. Why do we need to attend clinics?
Let me start by saying this.
Yeah.
There are people who will conceive
Yeah.
by choice. There are those who will conceive by mistake.
Yeah.
Not that the baby is a bad thing
Yeah.
that has happened, but there is one who will plan for conception.
Yeah.
It is okay to plan, and it is the best way to go.
Yeah.
And doing a preconception care
Yeah.
is also good. It prepares your body before that baby now set in your body.
Yeah.
You see? So being pregnant
Yeah.
can be by choice
Yeah.
or accidental.
Yeah.
And being accidental, I don't mean that usipende huyo mtoto. No. Things happen.
Yeah.
Family planning, they fail.
Yeah.
You may find yourself, maybe you missed the pills and all that,
Yeah.
then things happen. So the moment you know you're pregnant,
Yeah.
or you're planning to be pregnant,
Yeah.
let's start with planning to be pregnant.
Yeah.
You go and see your medical practitioner.
Yeah.
There are tests they can do prior to your conception.
Yeah.
Maybe they can check your blood levels to be sure if they are enough. Because the moment you conceive with a low blood level, you pose yourself to more risks,
Yeah.
even of losing this pregnancy
Yeah.
or having other comorbidities
Yeah.
that may arise as a result of the low blood levels.
Yeah.
There are medications that you can use to prepare your body,
Yeah.
you see. So when you do preconception
Yeah.
care, it is a way of preparing yourself, your mind, your body, and even your partner for support
Yeah.
during the awaited conception and the whole pregnancy as a whole, you see. So the other part is when you happen to realize you're pregnant. You are not planning to be pregnant, but you just found yourself pregnant. You should take the initiative of going to see a doctor.
Yeah.
Don't assume it's just 1 month, I don't have to see a doctor.
So allow me to cut you short from there. So if you realize it's 1 month down the line that you realize you are actually pregnant,
Yeah.
when are you supposed to start your clinics?
You can start as soon as possible.
Or as soon as you
As
discover?
soon as possible. Because you may discover today you're pregnant.
Yeah.
You assume you are okay.
Yeah.
You say, I'm 1 month pregnant. Let me start my clinics at 6 months.
Yeah.
Between this first trimester period, that is week 1 to week 12, there is a lot that happens
Yeah.
during that period, and it is as delicate as anything that you may think can happen in a span of minutes. So there are things that should be done during the first trimester, including the medications that we encourage the mothers to take.
Yeah.
There's a drug, there's a medicine or a tablet that is very crucial in the first trimester of pregnancy.
The first 3 months?
Yeah.
Okay.
Why? It helps a mother and it helps the baby in forming the neural system,
Okay.
the nervous system as a whole, if I may say. When I say the nervous system, it includes the brain, the
Yeah.
nerves, all the connections that deals with the nervous. Now,
Yeah.
if you don't take these tablets, the risk of having a deficiency
Yeah.
are very high. And what happens? The baby may end up having neural tube defects.
Okay.
Ile unakuta mtoto kona the spina bifida, hydrocephalus, other easy cleft palate and lip, ile kupasuka.
Yes.
All those are deficiency
Okay.
issues that can be handled during the first trimester.
Yeah.
So the moment you realize you're pregnant,
Yeah.
don't wait until you're 16 weeks,
Yeah.
you're 20 weeks, then you show up for the clinic. Hata kama ni mtoto wa 3, hata
Yeah.
kama ni wa 4, don't think that
You
not
have
a
enough
new mother.
experience
Yeah,
now.
I have experience. Remember, your body
Yeah.
doesn't have that.
Yeah.
It's the chemical system or your body system as a whole doesn't realize that you are a 3rd or 4th time mother.
Yeah.
You see, it requires to be prepared every pregnancy. So every time, anytime a mother realizes that they are pregnant, they should take the initiative of visiting a medical practitioner, a facility that they know they can be tested to be sure that they are pregnant. You know, you can be pregnant but not pregnant.
Yes.
Missing your periods is not that you're pregnant.
Yes.
So you'll be tested.
Yeah.
There are scans that can be done to be sure if the pregnancy is in the right place.
Yeah.
Then if everything is okay, then the doctor will schedule you according to the preference they have.
Yes.
Yeah. So clinics are very important.
Yeah.
Because there are many things we rule out,
including
many conditions that mothers will have. You yourself, personally, you could not be having issues with your blood pressure. But you get pregnant and the issues start arising. You have no issues with diabetes. From nowhere, your sugars are up there. You don't know. But now you assume and think, this swelling of the legs, it's normal. You know, I'm just pregnant, I will walk a lot. No. There are many problems that may be noted during the visits. You see, some people even have issues with their breasts during the clinics. The nurse may inspect, they may check at your breast, they may notice something, they will start preparing you for the breastfeeding period. You know, there are those who have even something called inverted nipples. They can be pulled as early as
inverted nipples are, what are those?
The clinics. Inverted nipple is a nipple that it's you know, normally inside. The nipple is this way. But now it's
in, where is it going inside?
It's getting, it's a bit inside, all it's flat. There are those who have flat nipples. So
during pregnancy?
Throughout. Even when they are not pregnant. So the moment you discover a mother like that, you know, there's a syringe, you start pulling them, you start educating them on how to roll the breast, on how to work on the breast, until by the time they come in to give birth, you have no problems with attaching the baby.
Because now you've managed to bring it out.
To bring out.
But so it's not a permanent condition. Can we even call it a condition?
No, it's not even a condition.
It's a situation.
It's not even a disorder.
It's a situation.
It's manageable.
If
discovered early enough before it brings trauma to the baby and the mother. Because if, I know you're wondering, how is it bringing trauma? Yes, it brings.
Because if a mother gets to see that she has no nipple, she gets to have a lot of concern, and they may not be able to express themselves to someone. So they are probably wondering what they are going to do, or they are sick or something.
The problem doesn't show itself during that time. You see, when the mother gets the baby in the arms, you want this mother to breastfeed. Now, the breast have milk, but the nipple is flat. The baby cannot latch the breast. So the struggle comes here. The mother is struggling a lot. She's desiring the baby to breastfeed, but the baby cannot get hold of this breast. So instead of coming to this extent, these are things that can be
dealt with.
And you know now, during the breastfeeding, they become very painful. Such that even the pulling with the syringe and the rolling is very painful. So when you do it before, it becomes more suitable and friendly to the mother because the breasts are not very full and they rehearse more frequently. But you keep encouraging. Sometimes even you can pick their numbers. Those who have those challenges, keep reminding them. Are you doing this and this? Are you doing this and this? Every time they come for a clinic, check on them. Check the breasts. Are we achieving? You see, usikae and assume that they are okay. My breasts are okay. Breast is not a matter of feeling milk. It's a matter of the suitability of this breast to the baby.
There is this experience that when you are breastfeeding, even when you have proper ones, there is this pain that comes with breastfeeding. especially when you have too much milk. What is this thing? Because it's a hell on earth.
Breast is a tissue, and if it feels,
Yeah.
it's like a bag.
Yeah.
If you fill a bag and squeeze something in that bag, eventually you see some stretching.
Yes.
For bag. Same case happens to the breast.
Yeah.
If the breasts are full, and maybe the baby is not breastfeeding adequately, or the milk is too much,
Yeah.
and you don't relieve that milk, of course the pain, there will be inflammation because of the swelling.
Yeah.
Inafura, kufura, and nerves are everywhere.
Yeah.
So the pain will be intense with the fullness of the breast.
Yeah.
So it is advisable if a mother is having too much milk,
Yeah.
either they express the milk, store in a bank, or express and throw away. But they should ensure their breasts are not full to extent that it is hard.
Okay.
They are
Hard to the touch.
Yeah, hard to touch. If the breasts are too full, they have a risk of getting something called mastitis.
Mastitis
Or
is not just for
engorgement.
cows.
No. You know, mastitis is for the cows.
Yes.
You are a cow as well.
And you just decide to call me a
Yes.
cow. Who does that?
A mother is a mother, even a dog.
Even a dog.
Yes.
So it's a
Yes.
condition that cuts across.
Across all mothers.
Okay.
Yeah.
Okay.
Have you seen a dog walking around?
Yes.
When the puppies are locked somewhere,
Yes.
the breasts are
Full.
very full.
Yes.
Even it walks
Yes.
cautiously.
Yes.
Yeah?
Yes.
Why? Pain. The movement
Yes.
brings pain.
Yes.
Yeah.
Okay.
So that discomfort
Yeah.
or that overstretching,
Yeah.
it brings a lot of pain.
Okay.
But there is always a management for that. You express and relieve the breast. You can do a cold compressions.
What are those?
You can use ice packs or a cold, a damp cloth with a cold. Okay, a cloth in cold water and sponge your breasts, especially on towards the armpits,
Towards
the
the
axilla.
armpit.
Yeah,
Okay.
this side, because that's where the inflammation is too much.
Okay.
So you relieve that pain with cold compressions. So you can use ice cubes
Yeah.
or cold compressions,
So,
or use painkillers. But when you use the painkillers, remember you need to express
Yes.
this milk.
so now imagine a mother who is in shags,
Yeah.
no access to fridge, no access or no way of getting pumps, you know. What are they supposed to do?
Okay, information doesn't reach everyone.
Yeah.
But those who are lucky enough
Yeah.
to visit hospitals
Yeah.
that are so much concerned
Yeah.
with lactation
Yeah.
and breastfeeding as a whole,
Yeah.
they know how to follow up. There are places you go deliver, just go home.
Yeah.
They don't even come to check whether your baby is breastfeeding, whether you have milk or not. They don't care.
Yeah.
If you are privileged to be in a place like our place,
Yeah.
in Grace Park,
Yeah.
we would never leave you go home without milk or the baby is not breastfeeding.
Yeah.
You see? Because we know the risks that may happen to this baby or to you as well. So that mama who is in that village,
Yeah.
who doesn't know, by the way, at some point wana survive kigod too.
Yeah.
Because ana wa kumwambia.
Yes.
And if they are lucky enough to share with someone maybe who has experienced that before, they can tell them how to go about it.
Yeah.
But if they have not got an opportunity to learn in someone's hands who has this information, by the way ni grace ya God tu, nikwambie ukweli.
That is
Hiyo ni
very
grace
true.
ya God.
That is very now. Tell me something.
Yes.
A baby is in the womb.
Yes.
Do they hear?
Very, 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 very much.
They hear.
Very.
And when can they recognize the different people they interact
much.
with, if I may say that?
Yes.
So even when they come out, like for real, it's not cliche when I say, by there this one knows me.
Yes.
From the womb.
From the womb.
Is it?
Yes.
And I even read a story where someone said that before the baby was born, the husband used to play a certain type of music.
Yeah.
After the baby was born, even when the baby was crying and all, anytime the mother would play that song, that music, he would just keep quiet and really just enjoy.
It's true.
So they even recognize such things.
Yes, that's why it's always good to talk positive about your baby.
But how do they understand that they are just...
Address them.
Is it?
Yes. Call them their names. If you have the name of your child, those who knows, my baby, this I will call them Destiny.
Yeah.
So call that baby.
Yeah.
Hey, Destiny,
Yes.
I'm talking to you. Address them.
They can hear you.
They can hear them very well.
Yeah.
And you say there are some things that they don't begin when the baby is born.
Yeah.
Bonding begins when the baby is
in the womb.
When you see a mother craving at times, it's not them.
So there is a connection. So when we say it's not me, it's the baby. Like for real.
The baby.
Is it?
Like, okay, before you got this baby, why were you not craving?
Yes.
Why? You could not go and take chocolates anyhow.
Yeah.
You could not go and take mangoes anyhow at mid of the night.
You're asking for mangoes.
There's someone who is commanding you.
Yeah.
So you see that board begins from the uterus, from the inside the womb. Anasikia tu kule. Ata kula direct, but the moment you take that thing, they feel good. So
basically, the functions are not meant to function outside here, like the eyes, the ears.
Let me tell you, the moment a baby is fully formed, you see at around 26 weeks, 27 weeks, 2 months delivery, 2 months 40 weeks. That's a baby who can hear a noise. That's why you can bang something. And you hear they stand still. You feel some stiffness. Why? They have ears.
I remember there was a time.
There is a time. Let me cut.
There
is a time we'll sit comfortably in the darkness. Then switch on the lights. There was no movement, but with the light,
starts moving. Kwani the stomach is. How do they recognize the light?
Don't worry. The way God has created this thing, it's like asking how does the baby get food?
Yeah. How does the baby get food? How does? What?
You know, pregnancy.
It's a conundrum.
Pregnancy is a very unique. Period for a woman. And actually, a mother should enjoy pregnancy. But at times you find there are many complications that may arise, many issues that make them feel like they don't want to be pregnant ever again. But with time, as these complications fade away, they start loving the pregnancy. Especially the first trimester, will push many. I don't want to be pregnant again. I don't want. But with time, as these problems go, they start embracing that love of being pregnant. So, asking if they know, or if they can see light. You have eyes.
Let me
when
ask
you're sleeping,
let me ask
somebody switches on the lights.
In terms of emotions, when a mother is in distress, does that affect the baby as well?
The baby will stay still.
Is it?
Yes, they won't talk. They won't move, They won't move. They will always remain calm. And mark you, the time maybe you are very happy
Yeah.
They will be
Yes.
happy with you. They will move with
You're
you.
operating in the
Yes.
same wavelength.
When you're talking to someone maybe you love so much,
Yes.
you're too close, you're too open, they will always be active. Hata kama si your husband, hata kama si your sister,
Yeah.
it's just maybe even a colleague.
Yeah. Someone you connect
Like I
with.
remember when
Yeah.
I had my second born,
Yeah.
there's a lady, we used to work with her.
Yeah.
And anytime she could show up,
Yeah.
I tell you, my baby could not rest. Movements.
Is it?
And I could just feel we
Yeah.
should sit together.
Yes.
Hata kama ni kiti moja tunasongana.
Yeah.
Anaketi hapo. Like we were so jovial when we are together. So my baby embraced that.
Yeah.
And it happened that even they shared their birthday.
Is it?
Yes.
What? The mysteries.
Yes. So
Wow. Yeah.
the happiness begins from inside. Whatever affects you affects
Affects
your
the
baby.
baby.
Yeah.
Is it because of the connection with the cord? What is it?
I think it's like a soul. Okay, it's like
Ama
it's
it's
more of a soul.
Yes.
Yeah? Like you are
Yeah.
so connected with your child.
Yes.
Hata akiwa kwa shida na uko karibu, you can
By then it's
feel
true,
this
you
stuff.
can feel.
Yeah.
It's true, you can
If
feel.
something happens to you now,
Yes.
wherever your
Yes,
girls are,
they will
can
sense.
feel something. So I think it's the same thing that happens. Yeah.
What? The fact that the child is able to connect with the mother. I even remember that there was a time I attended an event somewhere and there was loud music.
Yes.
I'm telling you, I could not believe. I even thought that there was a problem with the child, my first pregnancy.
The baby was so
Because
calm.
it was even traumatizing at that particular moment,
Yeah.
because it's like war.
Yeah.
The baby was
Yes.
just pushing and fighting, and I was like, what is happening? And that's when I read somewhere that it's possible to see, but you know, sometimes when you do research on your own, you're like, maybe this is just creation. Now, let's talk briefly
Yes.
about there are people when they get pregnant, they are vomiting, what happens? What makes people become so sick?
Pregnancies are different.
Yeah.
And we all undergo the pregnancy in our own unique ways.
Yeah.
And every pregnancy is unique in its own way. The first one will be too hectic.
Yeah.
The second one will be good. The third one may be better,
Yeah.
or vice versa.
Yeah.
And there are many hormonal changes that happen in our bodies. You see, the hormone that causes
Yeah.
the placenta to be formed, that is HCG, human chorionic gonadotrophin.
Yes. Yes, madam.
Yes, that. The so known HCG
Yes.
yenye tunapima kwa mkojo pale tukitaka kujua kama tuko na mimba
Yes.
or kwa blood.
Okay.
So that hormone brings a lot of nausea.
Okay.
So
Oh, that hormone is the
yeah,
one that, okay.
it causes a lot of nausea.
Okay.
There's a lot of GI, the gastric, the gastrointestinal system
Okay.
is highly disturbed.
Okay.
So you get to have nausea.
Okay.
So some will nauseate and not vomit. Others will vomit and have nausea. So that disruption of the hormone, the normal structure of your body, that's what causes those complications.
Yeah.
And it normally happens during the first trimester. Why? It's the time when the placenta is fully forming.
Fully?
Forming. Placenta
Oh.
will start forming.
Oh.
The fertilization has taken place.
Okay.
After the fertilization, we have fertilized an egg. Tutalea hii egg wapi?
I've actually never thought of that. Okay.
Tunalea hii egg wapi? Tumefuse hii egg.
Oh.
Ovum.
Lazima
na
tuijengea
sperm,
nyumba. We must build.
Zimefuse.
Yes.
Zimeform kitu moja sasa.
Yes.
Hiyo kitu tunailelea
Where will
wapi?
it grow?
We need a house.
Oh.
So this house
Yes.
cannot come from the moon.
Yes.
It can't be in a vacuum.
Yes.
It has to be attached somewhere. So this attachment, it's where the placenta now forms. It's a very broad thing to explain, but come to get deeper into it, you understand more.
But they grow together with the...
Yes, now the egg, the fertilized egg burrows into the skin, into the uterine wall.
Okay.
Inaingia pale ndani kwa wall.
Okay.
When it gets into that wall, now the growth begins. Placenta inaanza kuform. So hiyo hormone yenye inaproduciwa hapo placenta ina form, that's what causes. Hiyo hormone sasa inaitwa HCG.
Okay.
So if it is too much, the nausea is too much.
Okay.
There are those who are never bothered by it.
Okay.
And it will normally peak from the 5th, 6th week. That's when mothers will start throwing. That is barely a month after you missed your periods, or after the last day you earned your periods. If you, let's say you earned your menses on 28th of February. 4 weeks after that 28th, you may start experiencing those symptoms, like nausea, vomiting. You feel some funny metallic taste in your mouth. You understand all those weird feelings. So that hormone is the one that is responsible for that vomiting. And you know, this vomiting is not good.
Is it?
Yeah. To some extent, it poses a risk to the mother.
How?
And at the same time to the baby.
How?
The moment, if I feed now, I've taken my spinach, I've taken my whatever I've taken. I vomit it.
Okay.
What benefits does my body get? None. I've thrown everything away. So my body will have deficiency. And if I'm in deficiency, my baby too will be compromised. So you see, it's a two-way thing. In pregnancy, we deal with two lives. I'm fighting for my life, and I'm fighting for this unseen being. You see? So the moment the vomiting is too much, you should not assume and stay home. Some people lose pregnancy because of this. Dehydration, too much dehydration, it brings a risk to your kidneys.
Okay.
You see? Something called acute kidney injury due to hizo dehydrations. Electrolytes that are needed in your body to function for your other organs, your kidneys, your heart, they are also compromised. You start developing other complications. So anytime you discover that you are going through a lot of vomiting, you can't eat well, seek attention from a doctor. They will help you cope with this nausea. They will teach you on the diet to follow. They will give you medications that will help you cope with this nausea, because they are there and they are meant for such things. Again, don't assume and go over the counter. You may get a drug that is not right for pregnancy, especially the first trimester, that is so delicate to deal with. So we always insist, go the doctor's way. Go the doctor's way. Anything you feel unusual, don't assume. Just go the doctor's way. So I don't want mothers going vomiting everything, and they are still very comfortable at home, spitting, but they can't feed any. It's wrong.
Talking of spitting, what causes the spitting? Oh, it's the nausea,
the nausea,
as you said.
They can't swallow the saliva. There's changing taste and all that. And
Even
barely
the smell.
at 12, 13 weeks, most of the mothers will drop off these things and they will live normally. Especially the 8th, the 9th week, it's at the peak point. Hapo sasa. Hapo ndo mambo inaharibika kabisa sasa. They don't want to eat, they don't
because
want to
of
drink.
now that formation and the release of that hormone.
Yes, sasa inakuwa concentrated more.
Wow, that is great information. Underscore. You're learning a lot. These people need to start saying in Java.
Na tema mate huko. Muangalie vibaya.
Now, tell me, when it comes to babies, I've had some theories. I don't know whether it's just mere theory or there's any truth to it. Just to mention kidogo.
Yes.
Is it possible that we can actually determine out of preference to get a baby boy this time and a baby girl this time if we wish? Is there any truth to that?
No. You can't predict, by the way.
Even
Do you know which sperm will come out?
No.
Do you know?
And those things we
Do
hear,
you know
those
how
are
many
just
millions of sperms are ejaculated in one ejaculation? Do you know? 200 million sperms. 100 million sperms.
so
Do you know which one will
No.
get there? You don't.
So it's
So you can't tell.
So those are just hearsays.
Hearsays, my friend. But
Eh.
there are those who will, okay, just like mythical beliefs.
Eh.
There are those who know that I can try this, I can time this time of the month.
Eh.
And maybe you tried, for you it worked.
It worked.
So you believe it works for everyone.
Yeah.
But it doesn't go that way.
Yeah.
There are those, determination of sex of a baby.
Yeah.
It's a man who determines. Sisi tuko na moja tu hivi X. Tafadhali. Men, don't go blaming your women that they can't give you a boy.
Greet me. Greet me.
Please.
Okay.
I know. Yes.
Emphasize.
Men, they're the ones who determine the
Yeah.
sex of a child.
So if you have 10 girls,
I tell you, they came from you.
what can
The
they
man.
do? What can they do?
Nothing. If that is what is being produced in their store.
If they eat goats and they
My
eat
friend.
male goats and not female goats,
My
they may
friend,
end up having
genetics
boys.
cannot be altered with goats and those kienyeji things.
So by the come to think of it, you know, there are some cultures who are very hard on women,
Yes.
especially when they don't get sons.
Yeah.
And at the end of it, it's quite unfortunate because of lack of knowledge.
Yeah.
They have it so rough on their wives
Yeah.
that you can't even sire a son for me.
Son.
Kumbe, it is not on the woman.
Actually, as you are X.
Okay.
Whatever you're carrying is X.
Okay.
Your man should bring a Y
Yes.
or a X.
Yes.
So that if it's a girl, akileta X, it will be XX. If it's a boy, he brings a Y, it is a XY.
XY.
So if you bring me a X, don't expect me to give you a Y. No.
And me, I already have
So,
my ex.
Yes, so be happy with your exes.
That's a good
And me,
one.
I have my wives.
Yes.
So I'm happy with my wives.
Okay.
So I can't blame him that I don't have a girl.
Yeah.
Ask him.
That's a beautiful thing to
Yes.
understand. So men, please take it
Stop
easy on your
pressuring.
wives and pray to your God, or do, I don't know what you need to do. Anyway, now let's talk about a healthy pregnancy. And what comes, before we get to a healthy pregnancy, as a woman has conceived, if I may say it that way,
Yeah.
there are some changes that comes with pregnancy. I know we have a world full of children,
Yeah.
and that one goes along with this statement that I had actually put down. Somebody by the name Sheila Kidzinga. For far too long, many women, pregnancy and birth is something that happens to them rather than something they set out consciously and joyfully do themselves. As you started earlier, you had actually stated that sometimes you get pregnant not out of plan,
Yeah.
so it just so happens. And what that means, as long as men and women will exist, there will be children born, whether you like it or not. You'll still find yourself at some point expectant,
Yeah.
if your body allows,
Yeah.
and if God allows. Now, there are people who are not usually well aware of what will happen to their bodies, the changes that will come, and if they know, they are not usually ready emotionally to accept what changes. So what are some of these changes that Obviously, I know the first one is
The weight gain.
Some of us
Weight gain
are
is
still
about
struggling and dealing. And why is it that life is so unfair? The men do not even experience. Do men even? Okay, let's first deal with these things, and then you tell me whether men get to experience. As I go through the pregnancy, whether the husbands also deal with emotional whatever.
Okay, the change is,
Yeah.
okay, the moment you become pregnant,
Yeah.
as I said, there is physical change
Yeah.
that will occur.
Yeah.
Mothers will gain weight,
Yeah.
some will lose, not because they are not because it should be so, but because maybe they are not feeding well. Due to those complications of vomiting and all that, some will lose weight.
Yeah.
But if they recover from this phase, they will automatically gain.
Yeah.
But now this baby fat, so-called baby fat, it comes automatically, whether you feed or you don't.
Is it?
If you're not vomiting, you will gain. Upende ukatae, kilo itaingia.
Na hiyo kilo inakuanga ni mtoto venye anakuwa heavy ama inatoka wapi?
Not about the baby. The body itself adopts a new mechanism.
Okay.
That inaanza to store a lot of fats in your body.
Okay.
No. In attempt to sustain this pregnancy, kuna shifts zina happen kwa mwili yako, including the way your hormones are produced. Zenye zina deal with digestion, they change. Zenye zina deal with your mental stability, they change. You see, so these changes, a mother needs support, kitu ya kwanza. Because the moment a mother gains weight, not about how big the pregnancy is, if you gain weight and the person who is next to you keeps intimidating you for the weight, the way you have added up weight, since you became pregnant, you're very big. My friend, already you are altering the mental status of this person. That's another change that will happen to this mother. Emotionally, she won't be stable.
Yeah.
So changes, they occur due to hormonal differences.
Okay.
Hormonal changes that have taken effect in your body. And some of these changes will automatically drift away after you give birth. They will change kabisa and you come back to your normal state. That's why unakuta kuna when they were pregnant, they gain weight. After walimaliza hiyo period, wakanyonyesha, their bodies come back to normal very fast. Like me, in 3 months time, 4 months,
you're back.
I'm back. Kuna mwenye ata struggle for 2 years na kilo, trying to cut the weight. That's a change that happened during the pregnancy, and it was out of control. Yeah.
And the nose.
The big nose.
Oh my God. Most mothers, you can't even recognize them. Yani, the pregnancy has a way of humbling you.
Yes.
And it starts with the nose. Some women have a nose from here to here. If you measure, it's almost 1 kilometer. That's so ridiculous. What happens? Why does it enlarge the nose?
Those are things you can't even explain one on one, that this is, but a change can occur in any part of your body.
Yeah, even the hands
part.
You see,
yes,
some people's
will
fingers
have
become
fat
so
fingers.
thick.
Yes, thick. Why?
And others get
The
very
neck,
dark neck and they
all those
become.
are-
Why is that?
Hormones, the chemistry has changed. You're not dealing with yourself alone.
It seems like one day you'll even stop being a human being, you become a chicken.
Hey, pregnancy is
can-
a whole
what?
mystery.
Yeah. But at the
may
same
not
time, there are
understand it
people who
all.
become so beautiful.
Yes.
There are people who really glow.
Glow. Others will have rashes
Yes.
and
Yes.
acne and all that. All those are hormonal effects. You can't manipulate that.
Yeah.
You can't.
And others just hate
you,
people.
Yes, until you pass this period.
Yeah.
And your body comes back to its normal.
Yeah.
That's when you passed it.
So basically, this thing of some women saying, when I'm pregnant, I don't like seeing my husband.
Hey.
Is that genuine?
Imagine it happens.
Is it?
Yeah, you don't want. Sometimes you see,
Yeah.
one, it may come not consciously,
Okay.
subconsciously. you feel like you hate this man.
Yeah.
Or anything he tells you bothers you.
Yes. Even the smell.
Yes.
Yeah.
Unasikia mama anakuambia, I don't like his perfume.
Yeah.
Ameishi kuipaka. AJ, since you
Yeah.
met this man, it's the favorite.
Yeah.
But they don't want it that time. Why?
Yeah.
There is that mental disturbance.
Yeah.
No, there is mental disturbance that is already happening. Again, you see these changes of hormonal changes, unakuta there is change in taste. You see, that's something that is. So the moment you smell, it collides with whatever is in you, it brings a different.
Yeah.
So unasikia mtu hata hataki kusikia.
Yeah.
Ati kitunguu haiwezi kaangwa kwa nyumba wakiwa. By the way, you don't have to blame them for that.
Yeah.
Yeah, they will nauseate, they will hate you even when you do that in their presence, and they surely don't want that to happen.
And there are other wives or partners, spouses who become very clingy on their spouses.
Yes, actually, it is so. Same case,
Yeah.
there are mothers who become very sexually active when they are pregnant.
Is it safe?
Very safe, as long as there is no risks. Ujambo na daktari ufanye kitu inaitwa pelvic rest.
What do you mean?
Pelvic rest means your pelvis should rest.
How?
Ifai kuimba-imba. Isiimba-imbe.
Hey.
My friend, it is healthy.
So you're in short, what you're saying, if you've not been told to abstain, you
just
rock the boat or sink in it.
There are those who will enjoy sex during pregnancy, and when they are not pregnant, they don't find any pleasure in it that much. You see, but wengine the moment wako na mimba hivi, they just want that. It's the changes.
So
that
is
happen.
it's safe from day one to day last?
As long as ujaambiwa kuna shida yenye tunaona itakuweka kwa risk or the baby. There are conditions that will always warn the mother, especially some things to do with the placentation, your placenta mali attached and all those. There are those things that your gynecologist will advise you. Please hold for now until we are past this stage. Then after this we can keep enjoying it. Hold this until the head evolve, depending na the situation.
So you engage just like normal people without concern.
But you consider
without
the comfort.
Yes.
The comfort.
So what you consider is the comfort of the mother.
Because now you can't go up on a bump like this.
Yes.
How do you even do that? Even yourself, how do you do that?
Yes.
You see? So you look for styles. You can ask for a gynecologist to guide you. Even these marriage counselors, there are those who are so informed in these things. They can teach you. There are people who have gone through several pregnancies and they have gone through it. They can guide you. They can tell you, do this, do that, do that, to avoid the disconnection between you and your spouse. As long as you are safe and your baby is safe, enjoy sex.
So there's no way the man can reach the child?
Your cervix is very far.
Is it?
Very far. Very far. My friend, God created
Is it possible to tell that the distance?
You see, you men are very endangered. Their things are just outside. You can decide to do anything.
Yes.
But a woman,
before
you get to the inner part, my friend, it's a long way.
It's a whole journey.
Yes.
So there is no way he can reach the child. So safety guaranteed.
The cervix, the length of a cervix is very long.
Is it?
Yes. If your cervix is this long, this is your uterus. This is the vagina down here.
Oh,
Ata afiki cervix yenyewe, atafikia aji.
When it goes all the way into the stomach.
I tell you. God has created a woman unique. It's a package.
A woman is a creation of wonder.
Yes.
No wonder a man cannot withstand. I mean,
what women go through.
My God. Are we not wonderful?
Very.
Are we not wondering? Wow, that's a beautiful thing to know.
Yeah, so
Yeah.
those myths of having sex will make you miscarry.
Yeah, there's nothing like that. As long as you don't have conditions that can cause.
Yeah.
Yeah.
It's a lie.
It's wow. I think this is also a call to men. We will come to talk about the support to give the mother. But before that, I think it's important to make sure that people cement their relationship during the pregnancy. Don't say, I have had a few cases here and there where the husband is afraid of engaging with the wife because he thinks, not many men know about pregnancy. And kwanza, this show I think should go too much with men so that they can understand. So I've encountered a couple of them who are quite afraid of engaging with their wives because they are afraid they may harm the baby in one way or the other. But as it turns out, it's all good, all is well. Now let's look at the dangers that accompanies pregnancy.
Everything
Yeah.
evolves around changes in your body that occur. Your system adjusts accordingly.
Yeah.
From the cardiac, from your digestive system, everything changes for the benefit of accommodating this new creature that is in your body. So these complications that arise, they arise due to the changes that are already there. So the complication depends on to whom does it pose risk to. Is it the mother, the baby, or both? Because there are those that will affect the mother more.
Okay.
There are those that will affect the baby more. There are those that will affect the two of them. But every complication that arises, they normally have a remedy.
Okay.
Depends on your speed to seek for medical attention.
Yeah.
The most common that people know and believe in is bleeding. Mothers will bleed. Some will spot during pregnancy. It is normal, and at times it's not normal. Bleeding in pregnancy may be a sign of implantation. When the fertilized egg is implanting on the uterine wall, it's kind of drilling. So it shins part of uterus.
That is the early stages.
Yeah. So you expect spotting, but should not extend until 10 weeks, 13 weeks, 20 weeks, you're still spotting. No. So bleeding, any form of bleeding, any form of spotting, do not just assume it's implantation. Go for further inspection. Let the doctor check on you. Do the scans that are necessary. Be sure that you're safe and the baby that is growing is safe.
Yeah.
So for bleeding, it poses a risk of maybe the pregnancy is about to be miscarried.
Okay.
And if that happens, there are those that can be rescued. And there are those that
with
cannot
what?
be
Medicine?
rescued. Yes.
Okay.
Dawa. There are drugs that are meant to sustain pregnancy.
Okay.
That is hormones.
Okay.
You level up the hormones. Una boost the hormones.
Yeah.
That is synthetic hormones.
Okay.
To assist in supporting this pregnancy. Progesterone.
Yeah.
That support pregnancy. So if you give a mother these medications, at least they can carry on with the pregnancy. But with close follow-up, we have complications like diabetes, hypertension. Those are due to changes. You can't dictate your body sasa insulin yenye unatoa kwa mwili ikae hivyo hivyo tu. Remember kuna hiyo change sasa. Vile chakula inakuwa absorbed and all that, the demand becomes high for insulin. The glucose uptake changes. So with this change, ndo unakuta sasa a mother may become diabetic. Not that they have issues with diabetes in their home, ama yeye mwenyewe, but develop during
And after
pregnancy.
delivery,
and after
inaisha?
delivery
They are fine.
yeah. Others, it becomes secondary after inakuja kuitwa kama ni pressure tunasema secondary hypertension. It came as a result of pregnancy but it persistent.
Let me ask.
Yes.
Hapo, in case a mother develops a certain disease or condition, how independent is this child and the mother in terms of health? Like, for example, diabetes, high blood pressure, we have mothers who are HIV positive. Is it possible to pass this to the child?
You see, placenta
Where?
acts as a barrier.
Okay.
It's a barrier. It's like a shield that protects the baby from all toxic things that comes from the mother. Ni kama sieve. It allows the good things and sieves the
How
bad
is it
things.
able to detect that?
Mambo ya Mungu mama.
Because if it can pick the proper nutrients, foods,
Yes.
and all that, but it cannot pick
And
the
to
germs.
some extent,
Yeah.
that's why you're told do
Yeah.
not consume some things because they are maybe too toxic to be sieved by the placenta.
Okay.
Some will leak through and it will damage your baby.
Okay.
Yeah. Being HIV positive doesn't mean your baby will be positive. It's a barrier. Placenta is the barrier yenye inazuia mtoto, inachunga mtoto asipate hizo vitu. Eti HIV useme, you know, if it was the transaction between a mother and a child, it is one way for the nutrients. For the waste, so the mother gives the baby
the good things and the
mother,
baby dumps.
and the baby dumps.
So if someone calls you trash, you're just good to go. Because you're just trashy.
You're just taking the trash.
Oh my.
Yeah, so having diabetes, having hypertension doesn't mean your baby will be a victim.
Okay.
But you see, for things like diabetes, to some extent, they matter in the future.
Okay.
Because this is already something that it's now like a gene kameingia hapo.
Oh, okay.
Your baby is already exposed to these sugars, maybe zilikuwa very high and all that. Then wametoka kwa tumbo, there is that adjustment and all that. And you know, some of these things, they may result from the baby, not as from the mother.
Like in a case of diabetes, see, there are people who are born with diabetes and there is the other one that is lifestyle based.
Yeah, kabisa.
So that one passes through, ama it's through the genes.
Inaweza kuwa genetic disorder.
Okay.
Or organ failure.
Okay.
If your pancreas cannot produce enough of insulin, what happens?
Okay.
You always have those sugars.
Yeah.
Yeah. So being having certain complications doesn't really mean your baby will have these problems.
Right.
No. But there are those complications like diabetes that will pose a risk in future. That either to you or the baby. So many are the complications that arise. Even miscarriage is a complication, and it's so broad. You know, we've been talking about it.
Yes.
But for another day.
But I would like you to mention something about miscarriage.
Yes.
What's the difference between a miscarriage, abortion, and stillbirth?
A miscarriage is a pregnancy you lose in the first trimester. Okay, let me say the first months of pregnancy to around 12, 13 weeks when the baby is not formed well. Stillbirth, it's a fully formed baby.
What?
With their hands, with their brain, with their everything.
The whole person.
Yes, and the baby dies, no matter the cause of death, but the baby dies in the womb.
Yeah.
That's a stillbirth.
Yeah.
Or, and a stillbirth may be before or during the labor. A child may die during the labor. it will still be a stillbirth. Not during, after the delivery, during
The birth
labor.
process.
Yes, ametoka,
Once-
ajalia, hakuna any cardiac activity, hakuna anything, like ametoka tu, alikuwa ashakufa, but the baby was okay. Maybe tukianza labor, the mother was okay and the baby was okay. But kwa hii ka period ya kuleba hapa, the baby goes. It's still a stillbirth. A stillbirth could be during the pregnancy.
Yeah.
Mama amekuja at 34 weeks, I can't feel the baby, I don't know what, the movements have reduced.
Yeah.
Unafanya ultrasound and all that. It's a dead fetus. That's a stillbirth. But hii ingine tunapata bleeding at 8 weeks, 10 weeks.
That's a miscarriage.
It's a miscarriage.
Yeah.
Yeah.
So once you've gotten that baby, you can't call that a stillbirth.
That's not a stillbirth.
That's not a stillbirth.
If the baby is born alive,
Yes.
with signs of life, let me say signs
of life.
That is,
The heart
either
is beating. Yeah.
or the heart is
Yeah.
beating, that's not a stillbirth.
Okay.
It's a distressed baby,
Okay.
but not a dead baby.
Yeah.
So a stillbirth, it's a baby who has come out of the mother's womb with no sign of life.
Okay.
Completely. Yeah. For miscarriage, there is nothing you can say, this is a leg, this is a head. No. It's just some preconception, the conception pieces that...
Yeah. Just come out.
Yeah.
And in a case of abortion, which is just crazy, you approve of it when there is a problem, right?
Yeah. Especially when we have these severe abnormalities.
Yeah.
A baby is formed,
Yeah.
there is no brain.
Okay.
Now, you want this mother to carry this baby to term for what purpose? The baby won't survive.
Okay.
You just terminate the pregnancy.
Okay.
That's why it is advised, do an ultrasound
Yeah.
during the mid trimester,
Yeah.
especially around 16 to around 26 weeks,
Yeah.
to check for those abnormalities.
Yeah.
It will help you terminate this pregnancy before it is too late.
Yeah.
You don't have to wait 34 weeks to do a scan. Then you just realize, oh my God, I've been carrying my baby for 7 months and there's no brain. So we have to terminate this baby.
Yeah.
There are those critical abnormalities that cannot guarantee that baby to survive. So the doctor will counsel you, will give you all the risks, what that means, and initiate the management of terminating the pregnancy. And then you will need a preconception follow-up before you conceive again. Because there are those things that maybe predispose you to those abnormalities. They need to be handled before we get to a grown pregnancy again. Tusikae tena alafu tunafika the next pregnancy we are getting to 18 weeks. We find something different. We find a
How
baby.
long are you supposed to wait?
If you lose a pregnancy, wait for at least 6 months.
6 months.
Your uterus will be healthy, your body will be healthy. Both mentally, physically, you'll be stable. And you know loss, whether it's a big baby, whether it's blood, whether it's anything, as long as it's a loss you grieve. So give yourself time to recover mentally and physically.
But in case you conceive before then, because as we said earlier, it's possible to conceive
as you have
in
not
an unplanned manner.
You start
what will happen
clinics.
to your body?
Nothing happens as much.
Okay.
But remember, your body might not have healed.
Okay.
You don't know your healing process. You don't know how your womb is healing. There is a scar that has already happened. So as it recovered, we don't want incidents whereby you're conceiving when the first pregnancy, where the first pregnancy was implanted, and the second pregnancy, you are getting too early, that scar has not healed.
Yeah.
So it will move to another different place. Then you start maybe getting something like ectopic pregnancy.
Yeah.
Because now your uterus is not even ready. But now this fertilized egg will look for a place to attach itself.
Yeah.
You see? So it's good to be patient.
Yeah.
No matter how much you may want to prove people
Yeah.
that you're capable of being
Yeah.
a mother, being a father, be patient. It pays
Yeah.
for a good and healthy pregnancy.
Yeah.
So at least give yourself time to recover before you conceive again. Yeah.
Wow. So, how do you know, how do you know you have a healthy pregnancy?
A healthy pregnancy, my
Yeah.
friend. Many will tell you, I have a very bad pregnancy experience.
Yeah.
Why? It will be the smoothest, but things happen. Everything goes around, they change.
Yeah.
Hormonal changes. So, a smooth or a good, healthy pregnancy,
Yeah.
it's a pregnancy that doesn't have these complications. Unasikia, I don't know, bleeding, placenta previa,
Yeah.
placenta abruptio, diabetes, hypertension,
Yeah.
hyperemesis gravidarum, all those.
Gravidarum. What is that now?
That is the vomiting that
Oh,
we call morning sickness.
It even has a science name.
Yeah.
Gravi what?
Hyperemesis gravidarum.
Okay.
So,
Yeah.
if you find yourself having a clear vision
Yeah.
that, I wake up every morning, I can walk to work, I have no issues, my blood pressure is okay, I'm feeding normally, I have no problem, then you should enjoy the pregnancy. Those
But that is
small
is
things,
after making sure that you usually attend your clinic
the
so that
clinics
you don't
on
think
time.
all is well and
Yes.
something is wrong.
Yeah.
Yeah.
because anytime you see a doctor,
Yeah.
the doctor may see what you can't see.
Right.
I could be looking at you,
Yeah.
I can see your legs are
Swollen.
swollen.
Yeah.
But you think it's normal.
Yeah.
I'll just run my tests. I'll do kidney test. I'll
Yeah.
do the normal blood check,
Yeah.
blood full hemogram.
Yeah.
I'll do the blood pressure check.
Yeah.
And I'll be in a position to tell, is it that we are setting in pressure? I'll do urine. People assume urine. Urine, very important. Nafanya mkojo. I check urine. Does it have this and that and that? So, is my mother safe? Then this swelling is normal.
Yeah.
It's not a big deal.
Yeah.
So you keep the regular checks.
Yeah.
And if you have no issues,
Yeah.
kabisa, haikosi moja mbili. But kuna ile hata wewe mwenyewe unashukuru. I can sleep well at night.
Yeah.
I can eat and drink.
And you're good.
I can go and sit with people.
Yeah.
A day long, I can work smoothly.
Yeah. Yeah. So at what point should you start slowing down
To your normal, from your normal activities.
Yeah.
Some things come automatically.
Yeah.
Unless otherwise instructed by your doctor or your nurse. Like the moment a pregnancy gains weight, there are things you can't do.
Okay.
You can tie up your shoe,
Yeah.
tomorrow you can't do it.
Yeah.
Because the belly is big,
Yeah.
you can't reach, you can't wash your heels, you see. You can't lift a heavy bucket. The weight, your pelvic bones are the ones that bears weight. Already there is a weight it is bearing, so it can't handle more weight. So it comes with time. That you feel, yesterday I could carry this bucket. A week later, I cannot carry it because the weight has become more. So it comes with time. You can't tell yourself from next week now, I won't be lifting this. No.
Okay.
There are those who are energetic enough. They can run their errands normally throughout the pregnancy. They slow down, bear it to nothing.
Yeah.
And there are those that at week 20, they can't even walk. They have started feeling the weight. So it depends with individuals, and it's not sometimes by choice. It comes automatically. Yeah.
And can you talk a little bit about diet for what should a pregnant woman? I know initially we talked about some eat this, others don't like this, but like in a normal circumstance, from a medic, are there specific things pregnant people are supposed to eat? They just roll?
A balanced diet is all that is needed.
Okay.
You don't need to eat that and leave that. Balanced diet. Ensure you're taking enough of proteins, enough of greens, vegetables, starch. You know, you need that energy.
Yeah.
And again, there are those restrictions that may come with complications that come with pregnancy.
Yeah.
So if there is no restriction, you barely eat anything, but a balanced diet. Even with the restrictions, you still observe balanced diet, as long as it doesn't compromise the body or the complication that you have. Yeah.
Wow. Now, let us go back to the labor now, the labor ward, because now you are the one. And as I started there with my introduction, I said at some point each and every one of us has had an experience with. Okay, by the way, there are people who don't go to the labor ward. There are those who just know how to shoot their shot at the comfort of their homes and the roads, and they are good to go. And they are good to go. But majority of us have had the luxury of being handled by you, the midwives.
Yes.
Tell me, I've had cases of some people saying, me, I don't even labor. See, I don't feel this. I don't. What is all this? Because we have seen some women who just labor for a short time, others labor for long.
Yes. Because we are different.
Okay.
Your body is not mine. Your hormones are not mine. The way my body responds to the hormones is totally different from how your body responds.
Right.
If for instance, I get into labor now.
Yeah.
In the next 4 hours, I anticipate I will have very severe contractions.
Yeah.
Very strong. There is one who says, if I start having pains now, my labor pain will peak tomorrow.
Yeah.
Because we are different.
Yeah.
Amount of hormones produced is different. That is why, to some extent, the doctor or the nurse may find it good if they introduce synthetic medications so that they can boost the hormone. For example, the so common known Sinto.
Sinto.
Yenye watu ukisikia mama akisikia Sinto anakuambia akistaki.
Okay.
Yes. That's a synthetic drug.
Okay.
But what does it do to your body? Ina raise the oxytocin.
Okay.
It is an oxytocin.
Okay.
So hiyo oxytocin inasaidia nini? Ina increase the contractions.
Yeah.
So with increasing contractions, we expect you deliver early enough. So you fasten the delivery. But if we let this mother stay there with the poor contractions, with the poor progress, we remain there the whole day, maybe into the following day. Then we have issues with the baby. Anaanza kuchoka, all that, what.
So normally, how long is a healthy labor? How long should a normal labor take?
A mother who has, we have 3 phases actually in labor. The first is called first stage. That is where you labor. And the first stage is divided into 2. Whereby the first one is the latent phase. Whereby there is that now the ripening of the cervix and it starts dilating. Inaanza kufunguka pole pole, and with time inafika mahali tunasema 4 to 5 centimeters. Inakuwa active phase. Because now this active phase, the contractions zimeongezeka. Na there is a way the WHO has set it. There is a tool we use to monitor a mother in that phase, and we anticipate with active phase the mother is either going to deliver soonest possible. Or if there is delays, then the mother has to go for a cesarean section, depending on what kind of delay, what is it causing. And there are many interventions that are taken before we come to that conclusion. For example, that poor contractions. You cannot just take a mother for CS because of poor contractions. And yet you have not tried the augmentation of labor. You augment, that is, you boost this labor. When you boost the labor,
with what?
The
drugs. The one you
you boost the labor, the contractions. If now this mother doesn't deliver, or there is no progress, of course there are so many things deep down there before we come to augmenting that we look around. If we come to that point where now we are not succeeding, that's when now you take the mother for the cesarean section.
So what are some of the reasons as to why you would recommend a CS?
Some may be out of the...
Besides the free will?
The free will actually is highly discouraged. Because cesarean section has its risks. More risks compared to normal delivery. So there are those things that come from the mother. The maternal factors, and we have the fetal factors. The maternal factors, it's like maybe there are so many, but I can touch on few. Because as I told you, this field is so broad. If the more we tackle one thing,
it opens
we get
another
the roots to another one. So something like inadequate pelvis. If the mother has inadequate pelvis, something called a contracted pelvis. Contracted, maybe alikuwa na accident, maybe alikuwa na malformation during birth malformations. Those are things that we cannot undergo a normal process of labor. If a mother starts to get risks zenye zinafanya tupeleke huyu mama CS, pressure zenye ziko beyond control, all things have been done. We have to rescue this baby out of the uterus because we may end up losing the baby. All those, there are complications that will surely send this mother to CS. There are those that will come in the process of monitoring this mother. We realize maybe the baby has issues. The heart rates are going high, are going low. There is no regularity. The breaking of the waters. How is it? How is the color? If you find it greenish in color, it's a sign of distress
from the child. People usually say the child has pooped in the. Is it true?
It's poop. Nothing else comes green from there. It's that. So, and it's a sign of distress. So why would you wait for a mother who is at 2 centimeters with a meconium stained liquor to labor all the way to 10 centimeters?
Meconium, can you explain these things?
With that green magic.
Oh, it's the one which is called...
With that green water.
Right.
You wait until 10 centimeters and deliver a boga for a mother. So there are things that will automatically lead you to do a CS. A baby who is sitting. A baby who is sitting.
A baby who has chosen luxury over coming
out. Yes, in their mother's abdomen. They want to sit and relax. A baby who decides to greet you. Before. The waters break. The next thing you're doing, the baby is shaking. How do you expect to deliver that baby? It's impossible. A baby who doesn't, the pelvis is not enough to accommodate the baby to go down. Maybe the baby is too big. Maybe the baby is lying with the wrong diameters. There is a way the fetal head is meant to go down the pelvis. So if it loses the direction and goes the other way, definitely there will be a problem. And the baby won't go. The mother may dilate
Yeah.
but the head may never go down.
Yeah.
So this mother is not going to deliver. You end up to do a cesarean. That is why sometimes you have to be keen as a nurse, as a doctor, when examining a mother, not to miss out such things, because this mother may end up going into labor for a long time and then later discover we have been missing this.
Wow. You see, I'm posting because you are a pot of knowledge and information. I'm still expecting more from you, and I definitely assure you that whether you like it or not, you're coming back here, because I have so very many questions that I need. Because as you said, the more you talk about an area, the more it's opening up so many other things.
So many things.
Yeah. And so I will have you again and again and again on our show so that you can come and shed more light to us. And as we wind up, this is something we should always encourage when we are dealing with matters pregnancy and childbirth.
Yes.
What can you tell anyone who has a pregnant woman, whether it's a husband, children, parents, whoever? What care are they supposed to accord
to the
pregnant woman?
Actually, every pregnant mother, they need support.
Right.
Whether it's a financial support, moral support, emotional support, physical attention. You see, a mother should feel loved. They should feel provided. They should feel cared. You see, it begins with the partner. If they are lucky enough to be in a stable relationship or in a marriage, then this mother should feel, should experience that love. And love means support. They need to be accompanied. Not walking in streets alone. Every time they go to shop, it's alone. Maybe to some point, maybe the spouse is occupied with job, but at least on off days they should avail themselves.
I mean, we have 9 months.
Yes. So you can't be
busy
out
the whole
of
9
all
months.
those days.
Right.
You have been in work place every day, every day, every day. So the support comes from the spouse first. Extend it to your relatives. That is your sisters, your brothers, your children. Let them help you. If you have a big baby, a girl, a boy who understands, who can be sent, don't always walk around the house. Send them. Let them support you. Tell them, help me carry this, help me pull this, help me do this. That's support. Get someone who can talk to you. Talk with you when you're lonely. You know, sometimes pregnant mothers are weird. They may start thinking anything and they just start crying. From nowhere.
They are crying.
Ukiuliza mtu analia nini? Nimesikia tu nimeboeka.
By the way, what causes this emotional breakdown? And
you
are, right now you're happy, the next minute you're not. It's like you develop bipolar.
Yes. From nowhere to you're there.
Yes.
So they need support. Continuous support. Financially. Financially, sisemi mpe 10,000. No, that 1,000 that you have. Tell her, go and buy something for the baby. Go buy something for yourself. That way, they will feel supported. Not that the mother will carry the burden alone. I know there are single mothers. Maybe they got pregnant and they were dumped and all that. But even those single mothers, actually they need more support than the ones who are in stable relationships. Because this one may bring a very big gap when they are raising their children. It begins with pregnancy. If you feel rejected with pregnancy, even in raising this child, it becomes a problem. And trust issues will be very, very many in your life. So it's always, if you know someone who is pregnant, check on them frequently. Have you even eaten your food? Have you drank water today? Have you done some exercises. Engage them. All this is support.
Yeah.
Support doesn't need washing for them clothes.
Yeah.
Buying them. No. Anything. Anything for them.
Yeah.
Yeah. So anyone can provide support. Si lazima mama wa kanisa akuje.
Yeah.
Jirani, mama fua. No.
Yeah.
Hata hii tu surprise, unaona tu. Nunua chocolate pale ulete uone kama atakula.
Okay.
Anasikia
Yes.
mtu wangu ananisupport baya sana na hii pregnancy.
Sasa hata hakuna kitu kubwa umefanya.
Nini chocolate ya 100? Babe aki me supporting pregnancy.
Yes.
Na ni siku moja hivi tu. But to them
it means a lot.
A lot.
Wow. Thank you so much for sharing your brain with us. You are a very small person, but you have a very big pot of information in that head of yours. And we are more than grateful for coming over. I don't know, tell us something before we wind up. And I would actually even like to tell you to encourage the young people like you. Because, you know, like, one thing I love about our generation today is the fact that we, because I'm also in that bracket. I'm not old. Excuse me.
I wonder. Why are you pulling yourself with the old generation?
The old people. No, I don't belong there. I'm young. You know, us, the young people, we are doing big things. Anyway, you realize that this generation is actually achieving so many things before the age of 40. Yeah? Before the age of 40, people have made so much money. They have great connections. They have built houses. They have bought cars. They are doing the things that our parents at that time used to. They are achieving things our parents used to achieve when they were in their 50s and 60s. So this generation has really changed, because even someone like you find that where you are right now, they used to get there at an advanced age, which is quite commendable, if I may say. I don't know. And you just speak to our youth, because I also have a great passion for the youth. I run a mentorship program for the youth, and you know how we roll. Tell my peeps something.
Okay.
Yeah.
One thing that I know, walk by self-drive.
Yeah.
Don't be pushed.
Yeah.
Again, walk with a vision.
Yeah.
I'm targeting by this age, I should have achieved this.
Yeah.
It may not be 100%, but at least see the steps that you're making. Will I be in a position to have achieved even 75 of it? Make initiatives.
Yeah.
Make connections.
Yeah.
Don't be too jealous this year.
Yeah.
Don't be jealous. There is an idea you may speak out here. Thinking you're just speaking out of speaking, but someone gets that information and uses that information very deeply. Last evening, we were sharing with our colleague. Another colleague just came in and joined. You know, we stood for almost an hour along the route talking. And when we departed, the lady texted me and told me, "Today, you've challenged me. I'm going to work on something. I won't tell you what we were discussing about, but it's about growth."
Yeah.
And she felt she has been missing the direction all along.
Yeah.
So every time you focus to do something, purpose matters a lot.
Yeah. Wow.
Put all your best.
Yes, please.
Again, whatever you do, do with all your heart. Usifanye for the sake.
Yeah.
Remember, whatever you do, it will bear good or bad fruits. So if you put the right energy, you get the right fruits. If you put the wrong energy, then you will bear the wrong fruits. So it depends on how you want it to be.
Yeah.
So if you want to grow, grow with other people. A man is not an island.
It's true.
You need me, I need you. I'm a nurse.
Yeah.
I can't work without a doctor.
Very true.
I'm a nurse. I can't work without a physiotherapist. I can't work without a mechanic. I have a car, but I can't repair my car.
Yeah.
You see?
Yeah.
Make connections. Be open-minded.
Yeah.
Yeah. Don't be too rigid.
Yeah.
Think outside your profession. Think outside what you do.
Yeah.
And focus. More so focus.
Yeah.
Yeah.
So basically, that's how you've managed to get yourself, by the help of God, of course, to
Yeah,
where
of
you are
course.
right now.
Yeah.
Because at the end of it all, God has given us something. Each and every one of us has some authenticity. This statement I have to say. Let me sit properly so that it can go deep inside. Your authenticity is your monopoly. So basically, God has put something unique in each and every one of us.
Yes.
Know what it is, develop
work on
it,
it.
grow, and then make sure that you take care of your connections.
Yes.
Because we, as you said, no man is an island. We need each other to grow, to get wherever we need to get. So it's been real. I'm very happy that you came. Always grateful to have people to share our thoughts with, and people who come here to educate us. So we are more than grateful as Wanori's Escapade. And of course, so very many thanks to _Austin for making sure that we are seen. Without _ I mean, who will be here looking at me? And of course, the other one is right here on this side. Java. John Java Kiania, the Jav. These guys are the reason we are here. They're the reasons the reason we exist. And they have an event company, if I may say. Okay? So if you have weddings, you have events of whatever kind, you have something that you would like shot, photography. For information, they have what is it called? Drone. Yes, drone.
Hey.
You want your photos to be taken from
above.
from heaven
To the house.
These guys reach heaven. Anyway, they have a drone. They have high-tech, high-quality equipment. So I'm always grateful to have this team. They are some of the best people that I have had to work with. So thank you so much. Always a privilege, always an honor. You can as well follow their page on Facebook, on the socials, basically. Wako hapo. All right. Now, this is Wanori's Escapade. Always our pleasure, our honor to have you with us, and of course, as part of this great team. And I will sign out with this statement. The beauty of pregnancy. Remember, we were talking about pregnancy. This is someone by the name Wayne Chivisa. Beautiful name. The beauty of pregnancy is in the concealed revelation of a precious gift the future depends on. So tomorrow, when we are long gone, we will definitely have left somebody at the back to make sure that they carry on with our legacy, carry on with our history, carry on with our homes, carry on with our names. And that is what pregnancy holds. So let us take care of ourselves, take care of our pregnancies, take care of our children, because remember, that small baby that you have has that potential to become that mother. Every tree is in the seed. Okay, so every baby has that potential to become that mother, and every boy has that potential to become that father. So let us do the due diligence to take good care of ourselves, eating right, taking care of each other, loving each other, supporting each other, and of course watching Wanori's Escapade, because this is a prerequisite to good living. Okay guys, thank you so much. Wanori's Escapade, my privilege and honor. Remember to like, share, subscribe, and of course follow our channel, and of course our socials at Wanori's Escapade. God bless you and see you next time. Thank you.
Thank you.